Hi, Dr. Rosenblatt. I want to thank you for this time that you've given me to try to consolidate the information that you once had in this 3-page Microsoft Word document into a beautiful brochure. So we're going to use this information when you actually need to pitch your services to a brand new skilled nursing facility or to remind the staff what you require from them once the program's already implemented. So first and foremost, I've incorporated the brand new logo that you created called American Rehabilitation Consultants, along with your slogan of collaboration for pain and rehabilitation. The pictures to bring the audience's attention to the fact that you're in a skilled nursing facility, a physiatrist, working in partnership with the on-staff nurse to make a difference in that patient's life. Now, when you're pitching this to the nursing home, they're going to want to know what's in it for them, which brings us to the first enter page, your American Rehab Consultants. So you're not on staff. You're there to assist with those patients. Secondly, because you're consultants in the nursing home, that saves the nursing home and the patient from having to travel out to a physiatrist's office, thereby saving time, money, and reducing risk for falls, etc., that can take place during a transfer. So those are really key points to highlight to the nursing home, in addition to the fact that they'll have a physician on staff seeing every single one of their patients, for which they have to pay nothing, because you as a physiatry are billing that patient directly or their insurance directly. Then once you get back, cover what's in it for me, you're going to move on into how do you make a difference in the nursing home? And we're going to highlight 3 primary prongs of what your services will do within that nursing home. First and foremost, you and your staff will evaluate every single patient. You're hands-on, which helps you catch a lot of issues, whether they're related to your specialty or other issues going on with that patient. Secondarily, if the patient does require interventional pain without using narcotics, you can make a difference with trigger point injections into muscle or actual joint injections on site without having to take that patient out. The second prong highlights your familiarity with the rules. You're Medicare compliant. All of the notes will be in the skilled nursing facility's EMR within 24 hours of service. And you see those patients according to Medicare guidelines. The post-acute you will see twice per week, and for long-term care you can see up to once per month. The third prong of the services that you bring are with those complicated cases and pain management situations. So we're highlighting with the picture a physiatrist helping out a patient with their prosthetic, whether it be the fitting or the actual pain related to the prosthetic. Pain management itself, whether you're dealing with a patient who's addicted to narcotics and how to wean them off, making recommendations along those lines for the primary care, or looking for any contraindications of prescriptions across the spectrum of what the patient's receiving since the time they were discharged from the hospital and placed in that nursing home. And lastly, you can help with the rehabilitation recommendations that the nursing staff will be making with that patient. The very last page, and I think which will be most invaluable once the program's implemented, is reminding the nursing home at a glance, what is it you need from them? So first and foremost, you need a rehab liaison. That rehab liaison will actually be providing for you the list of new patients to consult with, along with your follow-up list. And the rehab liaison will ensure that the primary care has put in the orders for every single one of those patients to be able to have physiatry consult with them. And lastly, we have a list of those supplies and medications that are required in order to have on hand for the injections. So I think that it'll be very positive going forward, moving from a rehab documentation and 3-page Word doc that nobody keeps to an actual pamphlet that you can use for advertising and leave behind to remind everybody of what you need once you're on board. Thank you for this opportunity.